Prescription drug abuse in pregnancy and breastfeeding. Prescription drugs have many benefits for the people they are prescribed for. Consultation between an individual and their healthcare provider is an essential part of treatment with these medications. Prescription drug abuse, however, can result in devastating effects. These effects are particularly concerning where pregnant and breastfeeding women are concerned. This podcast provides essential knowledge about prescription drugs, their effects, and how you can introduce the topic in your practice with families and offer support.
Hi, my name is Inji Kim, and I'm from the Mother Risk Program at the Hospital for Sick Children, and I'm here today to discuss on the identification of prescription drug abuse in pregnant and breastfeeding women. First of all, the term prescription drug abuse refers to any misuse or non-medical use of a controlled psychotropic pharmaceutical drug. In other words, it's the use of a medication for purposes which are not therapeutic. Many of these prescription drugs have psychotropic properties, and some of the popular prescription drugs for abuse include opiate-based drugs, tranquilizers, stimulants, and barbiturates. Opiate-based drugs include medication used for pain relief with active ingredients such as morphine, fentanyl, oxycodone, which is also marketed as OxyContin and Percocet, codeine, which we commonly know as Tylenol 3s, hydromorphone, which is also known as Dilaudid, hydrocodone, and meperidine, which is also known as Demerol. Tranquilizers include medication used to reduce anxiety and panic attacks, and these medications include the family of drugs known as benzodiazepines, such as diazepam, marketed as Valium, alprazolam, known as Xanax, lorazepam, which commonly known as Ativan, and clonazepam, which is also known as Rivotril. Stimulants are medication used to treat ADHD and narcolepsy, and they're commonly also abused, and they include medications such as dextroamphetamine, marketed as Adderall or Dexedrine, and methylphenidate, which are Ritalin or Concerta. Barbiturates are used to treat anxiety, sleep disorder, and seizures, and they also have an abuse potential, and these include phenobarbital. Not only is it important to know the different names of these medications, it is also important to know the dosages, since many of these medications come in different strengths. Available evidence suggests that Canadians are among the heaviest consumers of psychotropic medication in the world. However, data on the number of individuals who use prescription drugs for non-medical purposes is quite limited. Looking at exposures in pregnant women, a recent study conducted on the neonatal hair and meconium specimens from at-risk neonatal population in Canada found that the samples were positive for narcotics in 11 to 17% of the samples assessed. Many data indicate that non-medical use of prescription drug is increasingly becoming popular, and this could be for many reasons. These medications are easily accessible. You can get it through other people's prescription, order it from internet, or even get it on the street. They're practically available everywhere. They're not considered an illegal drug, and people can claim to have their own prescription if they get caught. These medications are in general cheaper than illegal drugs, and there is this wide perception that pharmaceutical drugs manufactured in companies are much safer to take than illegal substances produced in underground laboratories. So what are some differences between therapeutic and non-therapeutic use of these medications? So unlike the medical use of the drugs, abuse of prescription medication involves routes of administration other than oral. So these people could crush the pills to snort it, smoke it, or inject it. Non-medical use often involves escalating and excessive dosages that may be taken in a binge pattern. And also, non-medical use involve administration of other drugs such as alcohol, cigarettes, a combination of different stimulants. And this type of consumption often leads to a deterioration of the user's life instead of improving the quality of the patient's life. The key factor might be that the prescription abuse is solely controlled by the user instead of in a therapeutic treatment where the dosages and the length of treatment is controlled by the clinician and the patient. Again, there's no accurate data on what percentage of pregnant and breastfeeding women use medication for non-therapeutic purposes. But added to the many barriers in identifying these individuals is the fact that there are no validated screening tools for prescription drug use.